Hello, I'm Dr. Andrew Neville, and I specialize in treating adrenal fatigue. Today, I want to talk to you about why my patients pee all the time. It's kind of a weird symptom that people don't necessarily connect or even think about as being overly problematic in too many ways. But frequency of urination is really a hallmark of adrenal dysfunction. Now, one of the main reasons is the problem with the adrenals produce a hormone called aldosterone. Aldosterone helps us to hold on to salt. And in the body, water follows salt. So if our adrenals are weak and we can't hold on to salt, we can't hold on to water, which is kind of why my patients will pee all the time. That also affects blood volume, can make patients lightheaded, affect the blood pressure being low, things like that. More important than some of those annoying symptoms in the frequent urination, it means we're going to be chronically dehydrated. And not just dehydrated superficially, dehydrated at a cellular level, which is not good because those cells won't function and work. So one of the recommendations that my patients will get is to increase salt consumption, right? A healthy sea salt, to basically rehydrate patients over time until the adrenals can regain the capacity to be able to handle that job. So one of the big issues with what people talk about as bladder issues with somebody with adrenal fatigue is this salt thing. It causes frequency and urgency. One of the other things that happens with regard to the bladder and the urinary tract itself is people can get what I would refer to as an irritable bladder. Right? People get irritable bowel. You can also get an irritable bladder because stress hormone over time damages this protective layer that lays upon the mucosal membranes, not just in the GI tract and the respiratory tract, but also in the genitourinary tract. And when that damage happens, it creates little pockets and pinholes and little potholes in that mucin lining that protects the urethra, the bladder, that whole tract, even kidney. When you damage that membrane, now it's vulnerable, right? That's vulnerable tissue. So you can get irritation. You can get the bladder trying to empty quite a bit because, again, it's got these pinholes and it's vulnerable tissue. So it tries to get that urine, which can be a little caustic, out. Sometimes my patients will also get diagnosed with something called interstitial cystitis, which is essentially this. It's this irritable bladder to a significant degree. I mean, interstitial cystitis is a terribly stressful and symptomatic condition where people have to, there's constant irritation in the bladder and the urethra, and people are having that sensation that they have to pee all the time. It's terrible. One of the biggest, most important ways to get at that is to, again, shift this physiology. We've got to prevent the damage that's happening to those mucosal membranes, right? So we've got to shift this physiology. It's absolutely key, right? Turn off fight or flight, turn on rest and digest. It's one of the hallmarks of what we have to do for whether it's interstitial cystitis, irritable bladder, but also even just the frequency from salt. There are other things that you can do for more of an irritable bladder. One of the basic ones is bone broth. Bone broth, or even collagen, powdered collagen supplements, has the constituents that are in this mucin lining. They're in bone broth. So when we consume that, we're giving the substrate to be able to heal and repair, kind of almost like paving over those potholes over time. We have to keep paving until we shift and fix this physiology, right? That's definitely the key. But we can use some bone broth to assist with regard to those things. So chances are, if you've got bladder symptoms, even frequent UTIs, things like that, it's going to be, could be an underlying cause. And that underlying cause can be this adrenal fatigue. Deal with that, and those bladder symptoms can go away over time. All my best.